Hi and Assalamualaikum. So we from TSP3 are going to discussing about infertility issues in Malaysia. Thank you for your attention and stay tuned.
Now, let's meet our group members.
Infertility is a condition of the male or female reproductive system characterized by the failure to conceive following at least 12 months of frequent unprotected sexual intercourse. Millions of individuals suffer with infertility, which impacts their families and communities. According to estimates, 1 out of every 6 person of reproductive age in the globe will experience infertility over their lives. If natural conception is not possible, couples can choose for fertility treatments. First, IUI, intrauterine insemination. That will be when sperm cells are injected via a catheter into the woman's uterus and up into one of the fallopian tubes. Next, IVF, that is in vitro fertilization. This is when eggs are extracted from the woman and her partner's sperm sample is retrieved. The egg and sperm are manually combined in a laboratory dish. Lastly, hormone injections. These stimulate the ovaries to overproduce eggs, increasing the chances of pregnancy.
Current data and graph. The graph on the slide show that percentage of birth per woman, or in the other hand, fertility rate against the year. The graph show that percentage of fertility rate in Malaysia is decreasing over the year. In 2010, which 2.1% fertility rate is recorded, the number keep decreasing until it reached 1.8% in 2018. This issue must be taken seriously because it will affect the demographic impact, economic consequence, and social well-being in our country. There are several aspects that lead to this issue, and the main aspect is infertility. On the next slide, we will show several factors that lead to infertility problems.
There are several factors that can affect fertility for both gender. The first one is alcohol. According to fertilityhealth.com, alcohol alters the way that hormones work normally, which lead to abnormalities in the level of progesterone, estrogen, FSH, and LH in the reproductive system. This may interfere with ovulation and the menstrual cycle, decreasing both female and male fertility. Furthermore, smoking also lowers fertility in both sexes because it increases inflammation and oxidative stress, both of which harm and degrade eggs.
There are many factors that can lead to infertility in female, and the first factor is fallopian tube damaged or blockage. Damaged or blocked fallopian tubes can prevent a woman from getting pregnant by interfering with the movement of the sperm to the egg, since we know that fallopian tubes are the location where fertilization occurs. The next factor is primary ovarian insufficiency, or known as the premature ovarian failure. This means there's non-functioning ovary, so no ovum will be produced, which will cause infertility because the ovaries do not make typical amounts of the hormone estrogen and do not release eggs regularly. Let's move on to the third factor, which is scarring from surgery. Uterine scarring, for example, can decrease the ability to get pregnant because it decreases the blood supply to the endometrial lining. This will also cause the cavity to be completely scarred and lead to infertility. The last factor that can lead to infertility problems in female is pelvic inflammatory disease, which are caused by bacterial infection that is spread from the vagina or the surface to the reproductive organs and higher up. This is also known as PID that can cause scarring to the fallopian tubes, which will also prevent an egg from being fertilized.
Factors that lead to infertility problem in male. There are several factors such as infection of testicle, poor quality of semen, anti-sperm antibody, and hypogonadism. Infection of testicle is caused by bacteria and virus that will damage seminiferous tubule, hence it will reduce the number and quality of sperm. Second factor is poor quality of semen. This is caused by smoking, exposure to toxin, and imbalanced hormone. Lack of semen may not provide enough medium for sperm. The pH of semen that is too acidic or alkaline will harm sperm and affect its function. The third factor is hypogonadism. Hypogonadism is a situation that the body not produce enough hormone, especially testosterone, LH, and FSH. It will decrease sperm production and function. And the final factor is anti-sperm antibody. Person body produce antibody that will kill their own sperm, decreasing sperm number and cause infertility. One treatment that can be used to cure infertility is IVF. What is IVF? In vitro fertilization is a process of fertilization where an egg is combined with sperm in vitro. The process involves monitoring and stimulating a woman's ovulatory process, removing an ovum or oval from their ovaries and letting a man's sperm fertilize them in a culture medium in the laboratory. Here are some procedures of IVF. The first step is ovarian stimulation. Ovarian stimulation facilitated the retrieval of multiple oocytes during oocyte pickup procedure in IVF cycle. In order to retrieve multiple oocytes, the ovaries are stimulated through daily administration of fertility medication. Throughout the course of stimulation, the follicle in the ovaries grow in size and potentially contains oocytes. Generally, it takes about 10 to 14 days for stimulation. It is perfectly normal to have a shorter or longer stimulation period, as the duration of stimulation can differ due to individual unique body constitution. Second step involves is oocyte pickup (OPU). Once the follicle have grown and ready for oocyte retrieval, sedation is given to relieve any discomfort during the procedure. The oocyte retrieval is minimally invasive and quick process. Oocyte retrieved through a needle which is guided by an ultrasound probe. A light suction is applied to draw and aspirate the follicle fluid in a collection tube. Embryologists will be standing by to pick up all the oocytes in the follicle fluid. The third step is sperm processing. The ejaculate semen sample is analyzed and processed accordingly in the laboratory to yield motile sperm. The process of sperm preparation helps to remove unwanted plasma, mucus, debris and dead sperm from the semen and isolate motile sperm, which will be used in fertilization. The fourth step is egg fertilization. Only matured oocytes are ready to be fertilized. Matured oocytes is injected directly with a single sperm through a process called intracytoplasmic sperm injection. It is a technique that combines oocyte and sperm to aid the fertilization process. The result of fertilization can be known the next day. The fifth step is embryo development. After intracytoplasmic sperm injection, the injected oocytes are cultured in a culture system. Fertilized oocytes may develop into embryos and later into blastocysts in the next 4 to 7 days. The development of embryos can be monitored closely through our time-lapse culture system. It is beneficial to the embryo as it allows close monitoring of their development without disrupting their optimal environment. The sixth step is embryo transfer. The fertility doctor will assess your susceptibility for fresh embryo transfer. Fresh embryo transfer is usually done on the 3rd or 5th day after OPU day. The embryo is transferred directly into the womb using a thin catheter. This process is generally quick and painless. The remaining of the freezable grade embryos are frozen and stored for future frozen embryo transfer. The process of frozen embryo transfer is similar to a fresh embryo transfer, but with an additional thawing process. The last test is pregnancy test. This test is to take a blood test to determine the embryo transfer outcome. This test is done about 10 days after the embryo transfer and detect the level of HAZIQ in the blood. HAZIQ is a hormone that is produced upon a successful implantation.
In Surah Ash-Shura, verse 49, أعوذ بالله من الشيطان الرجيم لله ملك السماوات والأرض يخلق ما يشاء يهب لمن يشاء إناثا ويهب لمن يشاء الذكور. Sadaqallahul Azim. In this ayah, Allah said that heaven and earth are the belonging of Allah Subhanahu Wa Taala, who has the power to create everything He desires. As Muslim, we should turn to Allah and seek Him, as did the Prophet of Allah Subhanahu Wa Taala. So, it is clear that child can only be granted by Allah Subhanahu Wa Taala and only if He wanted to grant. Individual may try medical treatment that align with Sharia along with the supplication to the Only One.
Some of you guys might be wondering if the treatment of IVF is based on Sharia or not. Muzakarah of Fatwa Committee of the National Council for Malaysia Islamic Religious Affairs meeting has concluded that IVF treatment is permitted. IVF treatment can only be done if the test tube baby created from the husband and wife's sperm. The sperm must not be obtained from someone else. The newborn has the right to inherit from family members, and the father of the child can be the walis of the baby.
There are many ways to increase fertility, and this is some of it. First, Stay hydrated and maintain a healthy weight. Next, cut caffeine and alcohol intake. And then, do a moderate exercise and manage stress well. And lastly, take prenatal vitamin and eat a healthy fertility diet.
In conclusion, infertility remains as a significant issue in Malaysia, affecting many couples and individuals who aspire to start a family. There are myriad of causes that can lead to infertility. Thus, our group has chosen one of the treatment, that is IVF, as the treatment offered by the experts to solve this problem. The Malaysian government has taken several steps to address infertility issues and provide support to affected individuals and couples. Despite the efforts, there's still more work to be done to ensure that all the individuals and couples facing infertility have access to affordable and effective treatments as well as emotional and psychological support. Here are some of the references listed that we have used to complete this assignment. So that's all from us. Thank you for watching.